We learnt from a government report that nearly half of youngsters cared for in England's children's homes are in places far from their home and family. The Education Secretary has criticised what he calls the indefensible practice of sending troubled children to far-flung children's homes, many in tough areas.
We're asking what can be done to improve things for young people in the care system. Joining us now, Jonathan Stanley from the Independent Children's Home Association and Carrie Wilson, who was in care herself until 2 years ago. Welcome to you both. Good morning. Carrie, when you hear calls like this for better care to be provided, surely you must just be thinking, of course. Yeah,
I mean, it's something that I work for and towards every day, but I'm not sure that, things need to change. There needs to be a big overhaul about how it's currently running.
What's your experience of care homes? Because you were in care for
many
I was
years.
In
foster care for 7 years, so I didn't go into a care home. But over that time, so in the space of 7 years, I had 7 different social workers at least, so about 1 a year really. And just a lot of issues that could have, been nailed out and made a lot better. And the people that I work with, the Care Leavers Association, so I work with young people that are leaving care, and the majority of those, their issues, they've stemmed from being in many care homes or many foster placements and having multiple.
Give us a sense of what the difference that makes, that consistency of care. What's the difference that makes? I mean, maybe stating the obvious, because most people are lucky to have a home, that is their consistency, isn't it? So when you have so many different people and you're passed from one to the other, what's the impact of that?
Well, I mean, if you take your own child, for instance, if you are not consistent with that child, then that child is going to be like confused and not have healthy kind of images and thoughts about what should be a healthy relationship and what should be a healthy way of living in a certain way. So if you take a child that's probably damaged, neglected, the majority of children go into care because of neglect, and then bounce them from person to person to person, you're going to end up with a person who, is very confused about what, and the stability isn't there.
It's really important that the point that's being made here, it's not only about the reform of children's homes, but we need to reform all of children's services.
Yeah.
So it's a much more radical and comprehensive strategy that we need than we're currently getting from the government. 25% of children in children's homes have had 5 or more placements. And many of them will have many tens of placements. So we are missing giving these children the stability and the continuity and a feeling of security.
So, Jonathan, really just to be clear, I mean, you represent children's home, independent children's homes.
That's right.
So do you see, are you too, if you're like a victim of the system, where are you suggesting that, the homes that you represent are having to deal with the problem created elsewhere? The issue of children going to so many different places?
It's certainly the case. If we were taking a wider perspective of the entire history of a child coming into care, we would be having a different conversation than we are now. There are many more things to be spoken about that need fixing, not only children's homes, although children's homes do need improvement. But we would be having a much bigger conversation, and we believe that's what we need to do.
Is there a consistency of care quality across homes? Because you're shaking your head, Carrie. Just on the front page of The Independent, another report taking a look at homes owned by private equity firms. So I'm presuming these would be under your banner. Some would be under.
Yes.
Many, 63, have not met the government's minimum standards. So it brings into question the general quality, the general intent to make sure that proper care is being provided.
I've not seen that report yet. However, there's another picture to be spoken about too. Over 3/4 of our homes are good or better. And that's something we're not getting the message through to the public, that actually our homes have improved and are improving. The 25%, yes, we do need to do something about, but the picture is one of improvement. There have been changes in the way Ofsted evaluate homes, and they have depressed the scores somewhat.
Carrie, it's a very complicated picture, isn't it? I mean, in this brief chat, people get a sense of how confused it is. What is the one thing that you would like done to help people at the sharp end, as in today, in the next month and next year?
There needs to be... There's a massive issue with postcode lottery. with local authorities. So you can be next to each other in local authorities and have completely different care packages, and there is no consistency about it. Absolutely. And there needs to be, you know, there's guidance there, but it's very broad. It needs to be, you know, nitty-gritty. Actually, what is this child getting? Because at the moment, children are just statistics. It's a tick box. Let's tick these boxes. Right, they've ticked those boxes. That child's fine. The emotional needs aren't being met. And that's where they're being let down, because they haven't got that person. They haven't got a feeling of belonging.
Carrie, thank you. Jonathan, thank you for your time this morning as
Thank
well.
you.
Time now is